Hi, I'm Brian. About 4.5 months ago, I finished treatment for cancer of the soft palate and back of my tongue area. I had 6 weeks of radiation and chemo mixed with it. And after about 4 weeks of radiation, I had a PEG tube put in. So I decided to make this video just to tell people a little about the PEG tube and what I've been through. I used to be an Ironman triathlete and did a lot of exercise, and after the treatment I had trouble doing even a couple of push-ups, but I've slowly worked my way back, and I run maybe 5 miles a week now just to make me feel good. I'm going to show you the tube, the PEG tube, and I'll explain it a little. Now, this is what's left of the PEG tube. I'll explain this in a minute. It's really not uncomfortable. It's not bad. It doesn't bother me, except I use a belt like this, a race belt, which is very helpful because it keeps it from flopping. And what I've done is tape it to here when I run so it doesn't flop around. By accident, yesterday, when I was cutting the tape off, I actually cut the tube, which was a very, whatever you want to call it, but it was very disturbing when it fell on the floor and started leaking. Luckily I found this clip that I use for paper to stop the flow and clean out the tube, and here is the portion that went on top. I tried to tape it, but there's not enough left on here. I tried a few things, but nothing really worked. Luckily, my throat's getting better, and I was able to drink the cans, which is this here, that is my nutrition. Plus, I can drink I can do other fluids and small solids like soup. It's about 500 calories in a can. Normally, what I'll do is I'll take a can, I'll pour it into a glass, and I'll add a little warm water to dilute it a little, so it's a little not so thick. It'll go down faster. And these come with a syringe, so what you would do is pop the top, put the syringe in the tube, which should be connected, and you just pour it with a glass and it goes down. And occasionally you might just tap it in the beginning, just like that, just to give it a little push if it got a little clogged. But and then after I'm done, I'll pour a glass of clean water through to flush it out so it stays clean. That's pretty much how that works. And it hasn't been bothersome, and I'm hoping maybe I can get it removed now that I cut it. So maybe it was a good thing, and I was time to stop anyway. It's been 4.5 months. Actually, the tube's been about 5.5. Anyway, I was going to do my push-ups now, so you can see what I can do with my training. I've been pushing on my push-ups. So here we go.
Ten. 20. 30.
Okay. Looked like it was coming out of it, so I cut it short. But that was fun. And I plan on doing other videos to explain the radiation and maybe how things work out. Thank you.